Hi, I'm Dr. Lee, an electrophysiologist specializing in atrial fibrillation. If you're living with AFib, you probably already know this condition doesn't just affect your heart. It affects your mind, your mood, your freedom, your entire life. Today, I want to talk directly to those of you who are living in fear. Fear of the next AFib episode. Fear of the palpitations, dizziness, shortness of breath, or worse, a possible stroke. Now, maybe you've stopped exercising, traveling, eating certain foods, or even going out because you're afraid that you're going to have an AFib episode that will strike you at any moment. You are not alone, and you are not powerless. AFib is unpredictable. It can come out of nowhere. 1 minute you're fine, the next your heart is racing, your chest feels tight, you're wondering if this is the one that sends you to the emergency room. That uncertainty leads to what we call hypervigilance. You start checking your pulse constantly. You avoid anything that might trigger an episode. Caffeine, exercise, even getting excited or intimacy. You become a passenger in your own life. And what's worse, many doctors downplay your symptoms. They'll tell you, oh, well, AFib's not life-threatening. True, but that doesn't help when your heart feels like it's spiraling out of control. So AFib isn't just a rhythm problem. It's a quality of life problem. So let me tell you something that I tell my patients every single day. Number 1, you are not broken. Number 2, you are not weak. And number 3, you are not destined to live in fear forever. There are options, but it starts with understanding your atrial fibrillation better. Not all AFib is the same. Some people have short, infrequent episodes. Others have long-lasting or more persistent forms. The right treatment approach depends on your specific pattern, situation, triggers, and your underlying risk factors that's causing the AFib to form in the first place. If you've only been offered medications or a cardioversion every few months, and you're still living in fear, it may be time for a deeper evaluation. Let's talk about how to start taking your life back. Step 1, build a plan. A tailored plan starts with knowing your triggers that put you into atrial fibrillation and patterns. Is it occurring after alcohol intake, or after poor sleep, or after an emotional stress, or is it just completely random? Once we understand your pattern, we can match it to the right strategy. Maybe using medications to slow it down or suppress it. Maybe doing lifestyle changes in early stages might be enough, or going to a procedure like an ablation to try to get rid of it from the inside. Ablation, when done properly, can eliminate or drastically reduce episodes of AFib, especially in patients who don't want to be on medications long term. Step number 2, reclaim your routine. Start exercising again, even gently. Movement actually helps stabilize your nervous system and heart rate. Get quality sleep. Reduce your alcohol intake. Lose the weight if you need it. All of these things help reduce your overall burden or amount of atrial fibrillation. Step number 3, retrain your mind. Fear causes stress. Stress causes increased adrenaline, and adrenaline can definitely trigger atrial fibrillation. If you become afraid of the fear itself, you need to break that cycle. Cognitive behavioral therapy, meditation, breath work, these aren't just wellness buzzwords. They actually can calm the nervous system that can help fuel your atrial fibrillation. I get it, living in fear is exhausting, and it's not always necessary. There is hope, there are solutions, and you don't have to settle for a life lived small. I've worked with patients who were afraid to leave the house, who are now symptom-free and living fully again. Not because of a magic pill, but because they got the right plan, the right guidance, and the right treatment for their specific situation. If you're tired of living in fear of the next episode and you're ready to take back control, let's talk. I offer telemedicine second opinion consults where I take the time to really understand your unique situation and give you clarity and to create a plan that gives you your life back. The link is in the description below. Until then, keep moving forward. Know that fear doesn't get the final say. For everything atrial fibrillation related, please feel free to go to my website, drscottlee.com, where you're going to find more resources and also can follow me on social media.